May 2015 marks the centenary anniversary of the King Edward Memorial Hospital, and to honour the occasion, a whole host of events took place across the community to remember 100 years of healthcare services on the islands. The hospital was originally erected in 1915, following the tragic events that took place during the Battle of the Falklands. And 100 years on, it has continued to flourish and grow over time, making it a hospital to be proud of. And this thought in particular was echoed by many during the opening of the Centenary exhibition at the Dockyard Museum.
And I think one of the big things for me about this anniversary is to reflect not so much on the structure, on the buildings, and of course they matter, but on the people. Because caring for people in the community is about those people who give up their time either professionally or voluntarily to look after people, and that matters so much to us.
In 1915, just a mere 14 members of staff worked at the King Edward Memorial Hospital, compared to a staggering team of over 100 strong that work there now. And it is their dedication and commitment to the job that is testimony to the local service.
Well, I'm Scott Betts, and I'm currently the stores and pharmacy assistant. I've done district care and I've worked on the ward as auxiliary nurse. But currently I work in the stores in the mornings where I help give equipment to different departments. And in the afternoon I'm in the pharmacy where I help with the running of the pharmacy, basically. As the population stands at the moment, we're in desperate need of an old person's home. So that will be tackled at some point in the future. So it's always going to evolve and develop, and we can see that today as we celebrate the centenary through the exhibitions, how it has exactly, in particular the demands of the population.
Hospital staff from then and now turned up in force to share in the joyous occasion and to relive some fond memories of their service at KMH.
I'm Joyce Allen, and I was born in the Falklands, and I go back quite a long way, hospital-wise and Falkland-wise. Well, before I was married in 1953, I was nursing for a while, not as a qualified nurse, but as a nursing aide. I left there when I got married in 1953 because married ladies in those days didn't sort of tend to work. And I had 6 kids at 8 years, so I didn't go back to work for about 15 years. I used to have to x-ray teeth, would you believe it? And we had one very serious, he was then a counsellor, a guy called Fred Robson, had very bad toothache and begged me to do something about it. So I had a word with the doctor and he said, well, you work in there, you deal with it. So I actually took this toothache for the guy and he took me down the pub for a drink. Well, you couldn't do that now, could you? Health and safety would kill you.
Well, hello, I'm Lydia Luxton. I've lived in the islands permanently since 1996, but I first came here in 1979 on a 2-year secondment from my hospital in England to work at the old KMH hospital. And in those days you had to be both nurse and midwife, which I was, and there was only 4 of us and a matron. So there was 4 of us, and for example on a day shift you would cover the outpatients, you would cover pharmacy, you would keep an eye on the ward, you would work in theatre, you could do anything.
The hospital is now a contemporary facility with general practice, dentist surgery, casualty service and a well-equipped operating theatre, all of which are growing from strength to strength and moving in the right direction.
Well, I think there are some important sort of shifts which modern healthcare and social care in the community are moving towards, and I think we can reflect that, and I think that will be a benefit. So I think the big concept really is, do we just wait till people are ill and then treat them, help them when they have the need? And it may seem obvious that we do, and we should, and we always will. But actually we can move beyond that as well. So as well as coping with crises, coping with ill health, we want to be a place that promotes health and prevents illness and old age, but also throughout the life cycle prevents the illnesses from arising that can be minimised.
The King Edward Memorial Hospital has played a huge part in so many people's lives in both the Falklands and beyond, and has become a vital pillar to the community and one that continues to be celebrated 100 years on. Sophie Dulson, reporting for FITV News, Stanley.